Hi guys, I'm just going to wait for more people to come in. I think we're expecting around 65 to 70 people, from what I've been told from the moderators. We'll wait for everyone else to come into the session and then we'll get started. Um, I'm just going to check a few things. Just to make sure you're able to send stuff in the chat. So yeah, if you have any questions, put that in the Q&A. If you're just saying general things, just stick that in the chat. Or when I ask questions, and if you're answering something, just put that in the chat. How long is it? It's usually an hour. It's usually an hour session. But it might be shorter. It depends on how quickly we get through the slides. So as I was saying, we're just waiting for more people to come in and then we can get started. Okay, I'll just wait for one more minute for a few more people to come, and then we'll get started. Okay, I think there's mainly 28. Will a recording of the session be available? Yes, it should be. I'm not really sure where you would find it. I'd probably just get in touch with one of the SIXMed people who sent you an email earlier on to ask where you can access the recording. Quick question, you're only going to go through SJT, just SJT. We've already done the other sections in previous sessions. So if you want to have a look at any of those sessions, you should access the recordings. If you're not sure how to, just email one of the SIXMed admin team. Okay, so I think I'm going to get started just for the sake of time. It's one more question. No worries. Okay, so today we're going to be covering situational judgment. So it should take about an hour or so to cover this section. And just a little bit about SIXMed, if many of you don't know the company. So it was a company that was created by medical students for other medical students, and in the past 6 years we've taught over 10,000 students. The kind of events we run are similar to this, so surgery webinars every Sunday 2 to 3 p.m. and essentially we cover different topics like UCAT, personal statement, interview preparation, and then like hot topics that might come up in an interview later on. So we run it throughout the year every Sunday, and they're free to attend. We also offer things like UCAT and BMAT support. So that can be one-on-one support where you're with one tutor and you go through things with a certain amount of lessons that you've bought, or we run these big interview courses, UCAT and BMAT courses, where we talk you through each of the sections in a lot more detail, and you'll have access to the crash course book as well. For that you need to pay, and you can go on the website and look up the course dates if you're interested. Similarly, for personal statement and interview prep, we do the same. We can either offer one-to-one support, or we can offer the day courses as well. So a little bit about me. This has changed now, so I'm going into my final year now, so I'm a final year medical student. I also did an intercalation. So if any of you don't know what an intercalation is, it's when you take an extra year at university to study an area, a scientific or a medical area of research of your choice. So I did that at Imperial, and I really enjoyed my time there. But normally I'm a medical student at Bristol, and I'm going back to Bristol this month. I really enjoy teaching, so that's one of the reasons why I do these surgeries, and I'm involved with a lot of like the personal statement, interview support, and tuition and things like that. It's just because I really enjoy doing it, and I'm quite interested in surgery and a field called endocrinology, which is everything to do with different types of hormones in the body as well. Okay, so things we're going to cover today. So first of all, I'm just going to introduce you guys to what the SJT is. Some of you may already know a lot about the situational judgment, and you might just be coming here for techniques and learning about how to approach the questions, especially if you're writing your UCAT this month or next month. But some of you may be here because you don't really know much about it and you want to find out more for sitting the UCAT next year. So it doesn't matter what level of understanding you have. Hopefully we can sort of help you understand the key concepts of it and how to approach these questions regardless. I'll also go through my top tips, and then we'll do some practice questions, and then we'll end it off with a Q&A. Now the Q&A, to start off, I'll just answer the questions which are specific to SJT and what we've discussed today. And then after that, if anyone wants to ask any questions specifically about applying to medical schools in general, or just university life or the course at Bristol, I'm happy to answer those questions as well. I do have a bit of insight into the course at Imperial, so I can help answer some of those questions as well. So in terms of housekeeping, I think most of you are already muted, which is good. Just make sure you stay muted, only because otherwise it creates a lot of background noise, which can be quite disruptive to other students. I'm trying to make these sessions as interactive as possible. So if when I ask questions, just type your answers in the chat box, and then I'll have a look at what your answers are. And in terms of if you want to ask a question yourself, try and put that in the Q&A box, because it's very difficult for me to sort of monitor the chat box when there's loads of you answering on there to try and dig through and find a question. So questions, stick it in the Q&A box. If you're just answering a certain question or that I've asked, or just want to say some general comments, put that in the chat box. Okay, So just to test if the chat box is working and also to have an understanding of where you guys are at in terms of your understanding on the SJT, can you just put down in the chat, on a scale of 1 to 4, how confident do you feel about the SJT? So 1 being not confident at all, 2 being somewhat confident, 3 confident but you want to find out a bit more, and 4 you're extremely confident. So I'll wait for a few seconds until everyone answers. Okay, great. So I'm seeing lots of 2s or 3s and then a few 4s as well. So most people have some sort of an understanding of SJT, but you just want to find out a little bit more about what the section involves. Okay, so the aims of this presentation is just to help you understand the types of questions you may get, and then also practice SJT questions as a group to see what kind of answers you're putting compared to your peers and why the correct answer is the correct answer over the one you put down as well. So that's kind of what we want to practice today. Just to go through what it is, first of all. So they essentially want to test your knowledge and your ability to approach various difficult scenarios in a medical context. Sometimes they may not be in a medical context. The bulk of the questions are medically contextualized, but some of them can be in non-medical as well. But what they want to test your knowledge on is the ethical aspects and whether you really understand what it means to be a professional in medicine. And I think they want to they want to test your morality and whether you would answer the correct way or not. So that's essentially what the situational judgment section is on. In total, there is 66 questions in 26 minutes. So although it seems like there's not enough time, so there's about 40 seconds per question, there's not enough time to answer all of these questions. I would say from personal experience and from teaching other students, SJT tends to be one of the easier sections because it's more testing your morals rather than any specific knowledge or trying to work out a certain equation, unlike in quantitative reasoning, for example. So what they're trying to test you on is just more your sort of morality and those kind of skills, those softer skills. So actually you might find that you have enough time to complete all your questions in SJT in general. So then there's 2 types of questions you can get. So there's something called the appropriateness questions, and then there's something called importance questions. So we'll go through both types and you'll understand what I mean by both of these. So for appropriateness, they will give you a scenario and then they will say, from this scenario, what do you think is, this is the response to the scenario, how appropriate do you think it is? And you have to choose between 4 different answer options to decide how appropriate that particular response is. Similarly, for importance questions, instead of asking how appropriate this response is, they will say, how important do you think is this response? Or how important do you think is this factor for this individual to consider when thinking about their response? So that's essentially what it is. So it's a lot better explained once I show you a question. So I'll go on to that in a few seconds. But before that, in terms of actually approaching your situational judgment section, there are 3 things that will really help you, especially with your appropriateness type questions. And some of you may have already come across this before, or for some people, this might be the first time you're seeing this. So whenever you get given a situation in a situational judgment question, what you need to think about in your head, you need to be asking yourself, is this response effective? Is this response well-timed? And is this response professional? So what I mean by an effective response is it resolving the issue at hand? If we did this response, is it resolving the issue at hand straight away? In which case it would be effective. Well-timed would be, is this the appropriate time to be resolving the situation? If it is, then it will be obviously well-timed. If it's probably, if you're delaying it and if you're not acting on the problem straight away, that would be a poorly timed response. So that's what I mean by that. professional comes under that whole concept of the being a good doctor and the GMC guidance to good medical practice. So if you guys haven't read that document, please make sure you read that before you do your SJT section, because it will really help. So I'm just going to type that in the chat. It's a very short document and very, very easy to read. All of the sections are in bullet points for you to just go through. And what it shows to you is, as a doctor, how do you act professionally? As a doctor, what qualities do you need to have in order to look after patients well? It teaches you all of that, which really helps you answer this question. I think someone had their answer up. I just saw it flash on my screen. Does that person still have their hands up, or was that a mistake? No worries, no worries. Okay, we'll move on. So I know it says 40 seconds per question. So what I'm going to do is I'm going to present you guys with slides with different questions on there. And what I'd like you to, I'll time you guys for 40 seconds, and there'll be, and by that end of that 40 seconds, I just want you to put down your answer after you've read the scenario, as if you would be doing it in an actual exam. It doesn't matter if you're unsure of your answer, just put an answer down, because this is just a form of learning so that you sort of get a sense of how these questions actually work. So let me just get up my 40-second timer. Okay. So this is the first question. So I'm going to give you guys 40 seconds to read the question and then pop your answer in the chat box. So 40 seconds starting from now. And I'll give you a warning when you have 10 seconds left. So we've got one response in the chat. So hopefully other people are starting to drop their answers in as well. Okay, 5 seconds left for anyone who hasn't answered. Okay, so that's the normal amount of time you would have to answer the question. So some people have said A, some people said B, and then some people are saying, one person has said D as well. Okay, let's go through this one because there is a mixture of different answers. So the question is saying, Roger is a medical student accompanying two junior doctors, Mark and Amy. The two junior doctors are making fun of one of the patients on the ward. The patient is within earshot and looks visibly distressed, but doesn't say anything. So the response is saying, quietly mention to the junior doctors that the patient can hear them and is looking uneasy. So what they're asking you is, how appropriate do you think this response is? And they've got A, very appropriate, B, appropriate but not ideal, C, inappropriate but not awful, and D, very inappropriate. So the people who said A were correct, so well done for anyone who answered A. The people who suggested B, you would get half a point. You won't get the whole mark for this question. You would only get half a mark. But I like the fact that a lot of people were thinking along the appropriate side of things. So I'm just going to get my annotator open. Okay. Oh, that was not supposed to happen. Let's just get the eraser out. Okay, let me redo that. It's very difficult doing this on a laptop, but okay. All right, so whenever you're thinking about answering these sorts of questions, I want you guys to sort of put a mental line between A and B, the options A and B, and the options C and D. And I'll explain why that's important. Because the first thing you need to do when you're looking at these questions, you need to decide, is this response on the appropriate side, which is either A or B, or is this response on the inappropriate side, which is C or D? So A is very extreme. It's like a very appropriate response, similar to D. So it's also a very extreme option on the other end of the spectrum. So that's very inappropriate. But once you've decided which side of the line, this mental line that you're on, it will then help you get the marks whether that's 1 whole mark or just half a mark. If you're on the completely opposite side, and if you notice that happening quite a lot with your questions when you're answering them on SJT, you might need to go back and have a read at the GMC guidance, because you're not interpreting the information given to you correctly. But let's have a look. So it's either A or B, and we've established that the answer is A. So let's have a look at why it's A. So do you guys remember the stuff that I talked to you about here? So always asking yourself, is the response effective? Is it well-timed? And is it professional? So let's go back to that and let's see if these 3 criteria are met and how you would decide between A and B. So by quietly mentioning to the junior doctors that the patient can hear them and they're looking uneasy, you're being professional, because you're not calling out Mark and Amy, the junior doctors, in front of lots of patients, and you're not creating a scene, which would be unprofessional. Whereas by doing it discreetly and doing it in a sort of non-confrontational manner, it means that, number 1, you're being professional, but also 2, you're not sort of seeking attention from the rest of the ward, who might, be looking in on the commotion, especially if you sort of said it in a confrontational way. So that's why the quietly mentioning bit ticks off the professional box. It's also well-timed because Roger is addressing the situation immediately. He's realized that that patient looks really distressed, and he's immediately addressing the problem by saying to Mark and Amy, I think you should stop doing this because it's distressing to the patient. So he's nipping it in the bud straight away. But this is also effective because when you think about the further consequences of this action that he's done, this response, if he stops this happening straight away by mentioning it to Mark and Amy in a subtle manner, it also means that they won't continue doing that throughout the rest of the day to other patients or to the same patient, making them more and more distressed. And therefore it meets all 3 criteria. So it's well-timed, it's effective, and professional. And one thing that you need to remember is Mark and Amy may not realize that what they're saying is quite horrible and quite distressing to the patient. They may not have picked up on that. So by, dealing with the problem straight away, it means that Roger is addressing all 3 of those criteria. So that's why the answer is A as opposed to B, because it hits all 3 of those things that we spoke about. Now, going back to this slide, is the response effective, well-timed, or professional? If it meets all 3, as it did for the question we just did, the answer would be very appropriate. If it meets 2 out of 3 of these things, then you would think about the answer being B, appropriate but not ideal, because it's still achieving something to some extent, but maybe not in the ideal situation or in the best way possible. If it only meets 1 of them, or if you could definitely have done a lot more to help this situation be better, then you would put C as your answer, which is inappropriate but not awful. And if it doesn't meet any of these 3 criteria, and if it actually goes against professionalism, which is obviously the biggest and the most important thing in SJT, then it would be a very inappropriate thing to do. So hopefully that made sense to everyone. I'm going to go on to the next question now because I can't see any questions in the chat. So the next question, I'll also give you guys 40 seconds. So 40 seconds starting from now. So try and implement these techniques. Is it well-timed? Is it effective? Is it professional? And also put that mental line between A and B and C and D and decide which side you're going to pick for this question. So this one shouldn't take you as long because it's the same scenario, it's just a different response. Right, 5 seconds left. Anyone else who hasn't answered yet? Okay, and that's time. So I can see, again, we've got a mixture of answers. A lot of people saying B, a few people saying A, some people saying C. Okay, let's have a look. So the response this time is saying, at the end of the day, mention to the junior doctors that their behavior was inappropriate. So can someone who put down their answer, can you tell me which criteria this has met? Which ones? Well-timed, effectiveness, and professionalism. Which ones has this response met? Or has it met any of them? Okay, lots of people are saying it's met professionalism, and some people are saying it's well timed, some people are saying it's effective as well. Okay. Okay, I agree with a few people who are saying not well timed. I think that's a really good point. So this one was B, appropriate but not ideal. So well done to the people who put down B. So yes, I agree with you. It was effective and it was professional, but it wasn't necessarily well timed, because by waiting at the end of the day, it links to the point I made earlier, in that Mark and Amy, both of those junior doctors, could carry on making fun of this patient or make fun of other patients as well. And essentially what could happen as a result of that is that the patients don't feel comfortable speaking to them, which can then compromise patient safety or the level of care that you're giving for these patients. And because it's well timed and you're delaying the problem, that's why the answer is B as opposed to A. Okay, great. So let's move on to the next one. So again, you guys are going to get 40 seconds for this one, starting from now. Ten seconds left for anyone who hasn't answered. Okay, that's time. So most people are saying C. Some people are not sure, B or C. Some people are saying D, and that person has said escalating is so it's not effective. Yeah, okay. So Hannah, the answer for the previous one was B, appropriate but not ideal. Okay, let's have a look. So there's a mixture of answers again. So Kriya has said not well timed, but it is effective. It's only effective. Okay, fine. So let's have a look. This one is D, is very inappropriate. So let's have a look at why this is. So someone did get the right answer. Someone said D and escalation as the reason for why they put down D. So that's really good. Whoever said that, well done. This situation is slightly different. As soon as you see something along the lines of the Roger having to escalate inappropriately, you're already thinking the answer is either C or D, more likely D. So escalation in these situations can either be appropriate or it can be inappropriate. So let's talk about why this time it's inappropriate. So if he's going and telling Mark and Amy's overseeing senior consultant about their behavior at the end of the week, number one, at the end of the week, it's not well timed. And it means that those two doctors are going to carry on doing this to other patients, and further compromising patient safety and the relationship that they have with their patients. So it's not well timed. And it's not effective because, again, you're delaying the inevitable and you're sort of dragging on the problem for longer than it should go on. And the third one, it's not professional. So why is it not professional? And that's where the escalation bit comes in. So if in any situation, if you go and speak to a senior without speaking to Mark and Amy first, or without speaking to the people who are doing something wrong first, number one, it doesn't give Mark and Amy a chance to rectify their mistakes, especially if they were doing it without understanding how their actions were impacting other people properly. That you don't give them a learning opportunity to learn from those mistakes. Number two, if we think about it just contextually in the situation, by going to the senior consultants, very busy people, and if you're going to them at the end of the week, they're not going to be able to do anything until the following week or even later than that. So that because that problem is not getting solved straight away and it's actually dragging on for longer, it's very difficult to think of this as an appropriate response. The other thing in terms of senior consultants is this is a form of inappropriate escalation. The first thing that the senior consultant would do if you go and complain to them about Mark and Amy is they would ask, have you spoken to them about this? Is this the first time this has happened? If this is the first time this has happened, then you just need to speak to them, give them a warning and say they should not be doing this because this can compromise patients' trust in doctors. And if they then stop, that's fine, especially if they were doing it because they didn't know the impact of their actions. But if this is a form of repetitive behavior for Mark and Amy, and you've noticed them doing it over and over again, then it would be appropriate to speak to a senior consultant, but not straight away. So that's why this is a form of inappropriate escalation. So whenever you have a problem, address it with a person who's creating that problem first. Give them a warning. If they continue to do it, despite you having that conversation with them, that's when you go and escalate to someone. So that's why the answer is D, very inappropriate. Okay, this one, I'll give you guys 40 seconds again. Ten seconds left for anyone who still has to answer. Okay, that's time. So most people saying D, which is the correct answer. Well done. So D, very inappropriate. So again, it doesn't meet any three of those criteria. So I have seen some people put C. So let's explain why D is the correct answer. So it's good that most of you are now on the correct side. You're at least realizing whether an answer is appropriate or inappropriate, which is really good to see. So why is it D over C? So first of all, it's not well timed because, you know, audibly lecturing them in front of everyone, you'd probably be better off taking them to the side or quietly mentioning to them, as we said in the first response. So it's not well timed. It's not effective because, number one, all the patients are going to be listening in, other staff members are going to be listening in. And again, that can cause a loss of trust between doctor and patients, especially if they see that the medical team aren't working well together, which is the impression you would give if you are audibly lecturing your junior doctors. And the third thing, it's not professional. Number one, it can damage Roger's professional relationship with Mark and Amy. Because they're supposed to work in a team, in a multidisciplinary team, and be there for each other. And it's also acting in a it's also acting in a confrontational and a very judgmental way, and also publicizing what's happening rather than just sort of quietly mentioning that they should probably stop what they're doing. So I think that's why the answer is D as opposed to C. Isn't it addressing the issue though? Yes. It's not addressing the issue directly because with the first response to that, yes, if you audibly lecture them, they'll probably stop, but it's more talking about the impact of that, which is what effectiveness refers to, rather than just the immediate effect. And that's why it would be D, very inappropriate. Because imagine putting yourself in that situation and you were someone was audibly lecturing you in front of your entire classroom because of something that maybe you didn't realize you were doing, then I would think that your relationship with that person who is audibly lecturing you is not going to be the same after that. And that could then affect how you treat patients in the future, because obviously you're working as a team to treat patients and make sure patient safety is maintained. So that's why D is the answer. So when is it C and when is it D? So C would be something, well, we can go through some more questions. I can show you some more examples. But if they had said something along, it probably wouldn't be C in this situation because it's a very extreme response from Roger. But we'll go through ones where C is the answer and I can explain a bit more in depth to you. Okay, so different scenario now. And you've got 40 seconds again. Okay, 10 seconds left for anyone else who hasn't answered. Okay. So this one, most people have said A. Okay, so let's have a look at the scenario first. So a patient called Roshan is due for an appendectomy tomorrow at 9 a.m. Dr. Aku was performing routine checks on the patient before the operation tomorrow and realized the team haven't checked a vital component of the patient's health, which could affect the operation. The lab is currently closed and will open tomorrow at 10, and therefore bloods can't be analysed before the operation. So the response is call the surgical registrar on call as soon as he can. Most people have said very appropriate, which is the correct answer. So can someone explain to me why you think very appropriate? Just type it in the chat. Yeah, exactly. It deals with that situation straight away. And obviously, in this sort of situation where you're thinking about sort of a surgical procedure, it's really important to speak to your senior immediately so that you can find out how to deal with the situation before tomorrow when he has the operation. Okay, this one, got 40 seconds. Ten seconds left. Okay, so let's have a look. Most people saying D, good. So that is the correct answer. So in this one, they've said reschedule Roshan's operation for the next day, but don't inform him while doing so. That can be obviously quite a bad thing to do. So it goes against professionalism because if you're not informing the patient, again, there's no sense of communication between doctor and patient. They can lose trust in you. They could get quite angry. And it's just very unprofessional if you know that information and you haven't updated the patient on what's going on. The second thing is usually 24 hours before a surgery, any surgery, patients tend to fast, so they don't eat at all. So if he then finds out through someone else that actually his operation has been rescheduled, then it's going to be really difficult for him. And again, he's going to get very upset with you. So it's not well timed. And for those same reasons, it's not effective either. And it can cause a loss of trust between you and that specific patient. So that's why the answer is D. Okay, this one. So this time we've got an important type of importance kind of question. So they're asking you how important are each of these responses to consider. So I'll give you guys 40 seconds for this one as well. So 10 seconds left for anyone who's still answering the question. What are people saying? So most people saying A, perfect. So this one, Joe, a final year medical student, comes to the ward extremely hungover and complains to Hannah that he hasn't slept all night, still feels drunk. Joe mentions that this is the third time this month this has happened and that he really should stop. He also recounts to Anna that he's found it difficult to carry out examinations when he's previously been in this state. So how important to consider is this factor? So they've said Joe has been asked to carry out a difficult procedure today. So he's previously mentioned that he's found it difficult to carry out examinations previously in this state. Therefore, if he has to carry out a difficult procedure today, obviously it's a really important factor to consider in terms of what what's her name, Anna, has to do in terms of whether she needs to say to him, like, you know, maybe go back home today, and I think you need to address this problem with someone else if you're constantly turning up hungover. So that's why it's a very important factor to consider. I think I've got a question. What's the question? Oh, no, it was just a response. Okay, fine. And then moving on to the next one. So again, 40 seconds. Ten seconds left. Okay. So most people saying A, perfect. No, I think everyone said A actually. Okay, great. So the answer in this is also, again, A, very important. So whenever in SJT type questions, when they mention the medical school has this certain role or the hospital has this specific role, it's always usually a very important factor to consider. And that's because you're thinking about the professionalism aspect. So usually you need to abide by the rules in your medical school, the rules in your hospital. I think it's just a given in general for anything. If there are rules, it's important, especially when it comes to dealing with patients, and that it's important to abide by them. So it's the medical school issued strict rules at the start of the year, prohibiting students from being under the influence of alcohol or illegal drugs whilst on duty. So obviously it's a really important factor to consider, because Joe, as a final year medical student as well, if he's extremely hungover and constantly is coming in drunk, that can compromise patients. As a final year student as well, you do tend to have a lot more responsibility, because you know you're only a few months away from being a doctor. So turning up drunk, especially in front of patients, can be very detrimental, and you might be involved in doing a lot more hands-on things for patients. So if you make mistakes with prescribing drugs or taking blood from them and causing harm, that can have lots of negative implications. So that's why it's a very important factor to consider as well. Okay, this one, 40 seconds for this one again. Okay, 10 seconds for anyone else who hasn't answered yet. Okay. So most people have put D, okay? And then some people, one person has put A, one person has put B. Let's have a look. So the answer is C, of minor importance. So let's have a look. So several other students are in a similar state to Joe. So yes, it's really bad that other people, other students, medical students, are also in a similar state, because that can again compromise patient safety if they were to go onto the ward. So it's something for Anna to consider. It is still to some level it is important, but it is not the most important thing, because this specific situation is talking about Joe, and doesn't matter whether other people are drunk. That doesn't mean that Joe should be treated any differently or have any less severe consequences just because other people have turned up that way as well. So in this situation, that's why it's important to note that there are other people like that as well, because she may have to report more than just Joe. But at the same time, in this situation where it's specifically discussing Joe, it's not that important that other people are drunk, because it doesn't excuse the fact that just because lots of others are drunk, that it should be okay for Joe to be drunk as well. So that's why it's C over D. Okay, and then this one, 40 seconds again. Ten seconds left. Okay, let's have a look. Okay, I've got mostly Ds. Great, so that's not really an important factor to consider at all. So just because he's made a bet that he won't be disciplined, that doesn't necessarily mean that he's not going to be. And, you know, it doesn't matter whether that's not really an important factor for Anna to be thinking about in terms of what steps she should take next in order to deal with Joe. Okay, and then this one, 40 seconds again. Ten seconds left. Okay, so there's much more of a mix of answers here. So the answer in this situation is D, not important at all. I know a few of you put C down. In this situation, confidentiality is out the window because he's gone against professionalism. He's come in drunk or hungover, and he has already mentioned that previously this has happened previously, and he's found it difficult to carry out examinations at that time. So that's why it's not an important factor to consider at all. To be honest, Anna shouldn't really be keeping this information confidential. She needs to bring it up to someone because this could have had implications either in the past where he might have made mistakes and people have just not, you know, realized that it was Joe who made that mistake, or and because it's happened repeatedly, even though he should know by the time that he's a final year medical student that he shouldn't be turning up this way. That's why it's not important for her to maintain confidentiality in this situation. Okay, hopefully those questions were useful to go over. I'm just going to go over some top tips and then just some last minute things. And then what I'll do is I'll open the floor to questions. So any questions, you can just from now start putting that in the Q&A box, and I'll answer them in the last 10-15 minutes. So the main thing to remember is to go over that GMC guidance to a good doctor. I'm going to screen share for us in a few seconds what that page looks like and what kind of information it gives you. Remember those three things, especially for your appropriateness questions: timeliness, effectiveness, and professionalism, because it can help you get the right answer, especially when you're debating between A and B or C and D. And make sure that you go with your gut, because usually it tests your ethics and your own morals, and usually your first answer tends to be the correct answer. So now, on a scale of 1 to 4, how confident are you guys feeling about the SJT? So just drop your answers in the chat box. Rahul, where can we see the recordings of the other topics? I'm not sure. I think you'll have to email one of the 6med admin team. Okay. Right, so that was the end of my slides. I'm just going to stop sharing for a second, and I'm going to reshare the GMC screen. Just bear with me 1 second. So this is what it looks like. I can also post the link for you guys in chat now. just so it's easier for you to access. And if you scroll through, it's got this tab on the right side, which basically tells you the different sections. So the first bit is duties of a doctor, second bit is professionalism, third bit, and then it goes over the 4 domains that you need to sort of have as a medical student or as a doctor. So domain 1 is your knowledge, skills, and performance. Domain 2 is your safety and your quality. Domain 3 is communication, partnership, and teamwork. And domain 4 is maintaining trust. So it talks through all of the things you need to do in order to be a professional, medical professional. So if I just click on, let's just go to professionalism and action. Let me go back. Duties of a doctor. So it's got all of these different things. And then if I go into domain 1, it literally has it in bullet points, as you can see. So it says you must be competent in all aspects of your work, blah, blah, blah. And it just goes through every single thing that you need to do. It's almost like a little rule book or things you need to meet in order to be a medical professional. So it goes through all of these different things. So respecting patients' right to seek a second opinion, blah, 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 all of those different things. And then if I move on to, and you can see how short of a page it is as well. It's not too long to read at all. It's very straightforward. If I go to domain 2, it's just literally 1 page, again, done. So very easy to read. Don't even need to make notes on it. You just need to read through it once, and it usually, is a very, very easy read. Again, domain 3 is another page, and then the last one, domain 4, your final page tends to be a little bit shorter. Actually, no, I'm wrong. This is not the short one. So it just goes through the little things that if it does come up in an SJT or in an ethical scenario, this is something you can fall back on in order to answer some of those questions. Okay, so let me stop sharing again. Right. Oh. Okay. How can we get access to the rest of the webinars? I've already answered this question. I'm not sure. You're going to have to email 6med admin. It's the same email. I've been consistently getting a band 2 in each mock that I do, even though I've been analysing my answers and trying to apply new learning to each SJT practice mock. How can I for sure improve my score to a band 1? Try using the technique I mentioned, so talking about well-timed effectiveness, professionalism. The other thing you might need to do is just go and have a read over the GMC guidance again. And I think that will help refresh your memory. Other reason might be that you're a bit burnt out, so just take a break and then start doing questions, like take a break for 1 day and then go back to doing questions. That might help. How much of the GMC do we need to know for the SJT, as the volume of information is overwhelming? So what specific parts? I mean, it's not too difficult to have a read through because they're all bullet pointed information. I would say just have a read through of the whole guidance to a good doctor. You don't need to read the rest of the GMC documents, just the guidance to a good doctor or guidance to good medical practice, whatever it's called. How did you do well in A-level chemistry? It's just regular revision throughout the year. Don't cram your revision at the end of the year. Do it throughout the year, and take regular breaks. Make sure you're doing stuff outside of your A-levels as well. You're not just cooped up in a room revising all day, because you will get burnt out before your exam. For chemistry, it is a lot more visual. I'm a lot more of a visual learner, and it's a visual subject anyway, especially when it comes to organic chemistry and things like that. So I would find as many past papers or question banks as I can and just do them, and then take half an hour break, then go through the answers I got wrong, then do a different subject. So I did biology, chemistry, English literature, and an EPQ. So there were 2 essay subjects and 2 non-essay subjects. So I would pair an essay one with a non-essay one. English I found quite easy. So I would pair up English with chemistry, because chemistry is a bit more difficult for me. And then I would pair up biology and then my EPQ essay stuff together. So do that and make sure you have a regular revision timetable. The thing to do with A-levels is review, because a lot of your content is just stuff. They test you on certain things that you need to know the basics of really well, and then they put it into context and ask you more difficult questions. So in order to understand the key concepts, you need to review. However you review, or however you enjoy doing that sort of revision, my way is to make flashcards and regularly test myself and go back on topics. So what I had was an Excel spreadsheet, and I put down all the topics for chemistry, biology, and English, and I would just have dates down throughout the year and see when I last reviewed them, go back to the same topic, re-review it, and then just have like a traffic light marker, red for I don't really understand it, yellow for sort of understand, green for understand it really well. But I would still make sure, even if I have green sections, I still review it, because you can forget it when you're looking at other things just because of the volume of stuff you're learning. I applied the exact same thing for medical school. I just finished my finals and it worked. And, you know, reviewing flashcards, or whether you prefer to write it down or draw diagrams or look over your notes or read your notes out loud, whatever it is, make sure you review. Does Oxbridge and Imperial consider SJT? Well, both of them use the BMAT, so I don't think they really look at any of the UCAT stuff. So I'm still not clear on the difference between effective and well-timed. So well-timed is, are you addressing the situation straight away, and or are you delaying the problem? Effectiveness is what sort of impact is the response having? So is it a positive impact or is it a negative impact, or could you have done more? So that's the difference. So time is to do with time, effectiveness is to do the impact. I know how to differentiate between very appropriate and appropriate but not ideal, but please need how to differentiate between the answers important or very important. So very important would be things like that, medical school regulations and rules, and things that can definitely not go against professionalism, or the things that's been said in the GMC guidance. Just important is, yes, it's an important factor to consider, but it's not the end of the world if you don't consider it. I think that's what they mean by that. So it's not necessarily outlined specifically in the GMC guidance, but it's still to some extent important in order to maintain patient safety or patient relationships. What will Oxbridge have instead of BMAT? I'm not sure, really. I'm not sure. No problem. What's the best thing to do a week before the UCAT? One mock a day. I would recommend one mock a day. And AR, doesn't matter whether it's your strongest section or if it's your weakest section, you need to be doing 10 to 15 minutes of AR questions daily, just so you sort of train your brain to identify patterns and keep identifying patterns closer to your exam. So 10 to 15 minutes of AR every day, and one mock a day, and reviewing your sections properly, not just flicking through the answers, actually sitting down and reviewing them properly. BMAT is getting scrapped from next year. Do you know the alternative? No, I'm not sure. I'm sorry. I don't think anyone has been told yet. How would I know if it's appropriate but not ideal or not important at all? So those are two different things. Appropriate but not ideal, go back to your well-timed effectiveness and professionalism bit. Not important at all would be something that doesn't really make a difference to your response. Do you have any advice for the night before the test? The night before the exam, or the day before the exam, don't do a mock, because it will just stress you out. Don't do any practice the night before. Just relax and make sure you get into the mindset of exams. And just make sure you sort of know when you're waking up, know how you're going to get there, plan everything, just to make sure that you're as least stressed as possible. How do you improve reading for VR, and any tips for VR? There is a 6-month surgery that was done for VR, so go have a look at that. Reading for VR, you just need to be timing yourself. You can go get like a non-fiction book and sort of ask one of your friends or your family to pick out certain keywords, and they can give you a list of keywords, and you can just have a go at actually scanning the text. Don't scan the text left to right, because you will just end up reading the whole sentence. Try and scan it back to front. So scan the sentence from the last paragraph from back to front onwards, or in a zigzag pattern, because you're more likely to find your keywords faster. When would you recommend starting preparing? You probably need at least a minimum of 6 weeks prep, 6 to 8 weeks. So sometime in the summer, depending on when you book your test. I have my exam on the 25th. I've only done one mock for a specific topic. How often should I be doing mocks? Well, the week before, you should be doing a mock every day. In these few weeks in the lead up to your exam, you should probably be in 2 to 3 mocks a week. But what you need to do is pick 2 sections a day to focus on. And if you notice that you're particularly weak in one section, make sure to do that section every single day, so that you can improve your score in that. If you then find that you're falling behind on the other section, then that's the section you would be swapping to do every day. So you just need to work based off of your scores. Yes, you can use GDC as well if you're applying for dentistry. Could you tell me a bit more about your journey to medicine by Bristol? How is life there compared to Imperial? Well, for me, I knew I wanted to do it in year 11, which was a good time because I had my work experience then. I managed to arrange some work experience in obs and gynae, in one of the hospitals, and for 1 week, and then I did another week near my local GP, and then I did a week of residential volunteering in a care home, which is where you stay in the care home. You get your own accommodation and everything, but you stay and you sort of get to know the patients for a bit longer than you would if you just volunteered with them for like a day or 2 days. So that was really nice as well, and that was basically sort of my work experience. And then throughout the year I did volunteering at Age Concern charity, so that was my sort of long-term work experience. And then I went to lots of like different get into medicine conferences, anatomy workshops, that kind of thing, to just show my interest. And then year 12, so that's when I did UCAT, and then I chose Bristol based on my UCAT scores. Basically, I went for Bristol, Cardiff, King's, and St George's. So those were, I did 2 London, 2 out of London unis. And then I got my interviews. I had Bristol and Cardiff, and King's for interview. And then I chose, my top choice was Bristol, only because of the way the curriculum was. And you had a lot of patient contact from the first year. So and it just seemed like a very nice city when I went and visited there. So that's why I wanted to go there. They also they had a new curriculum, where they were doing a lot more patient contact and a lot more sort of to make sure you're improving your communication skills. But because some universities, they only start your clinical placements from your 3rd year onwards. So you're sitting in a lecture theatre for 2 years learning, but then actually going and speaking to patients and putting your learning into practice is a very different skill to theory. So the fact that Bristol was doing that from 1st year, it was one thing that really appealed to me. So that's why Bristol. And I had my interview for Bristol and Cardiff in November, and then I found out outcomes for both of them towards April, so quite late. And the reason why is because they have batches of interviews. So they have interviews in November, then another one in December, then January, then February, March. They have batches every month. So it took them a long time to get back to all of us. And then, yeah, so I'm obviously going into my final year now. So I've already done 5 years. And I intercalated between 3rd and 4th year. And I wanted to do it outside of Bristol because Imperial was the only place that offered the intercalation I wanted to do, which was an endocrine. And it was a very research heavy university, and I did want to learn a lot of research. So that's why I went to Imperial. Imperial, from my peers who were studying medicine as well in Imperial, who I met there, it's intense in a different way to Bristol, in that they have a lot more theory-based specific module exams, which is tested throughout the year in pathology and stuff, very, very in-depth stuff, which you may not necessarily need when you're in clinical practice, but it's good to have if you want to go into pathology or microbiology or whatever it is. Whereas in Bristol, you get taught the necessary things you need to know for clinical practice, and you get good at sort of speaking to patients, interpreting that sort of data. So you still learn the same type of information, you just learn it in a different way. And rather than being tested throughout the year, we do still have exams during the year, but they're more mocks for us to just sort of see where we're at and work on our revision. And the ones that counted were towards the end of the year. So when you're looking at courses, it's also really important to look at what kind of course would suit you best, whether you prefer to be tested every few months or whether you prefer to have mocks and then be examined at the end of the year. It really varies, and some people are different universities, some of them are tested through coursework, some of them are just tested through exams. So you also need to think about, do you like essay writing, do you not? So that can also determine where you want to go. I'll only take one more question because we're running over a bit. What site, actually no, there's quite a few short questions, I can answer those. What site would you suggest other than Medify, MedEntry and UCAT Ninja? MedEntry is the best one because it's the hardest, it has the hardest questions, and it's the one that mimics your actual UCAT the best. My UCAT's day after tomorrow. How can I deal with test anxiety? Just, obviously don't do a mock tomorrow, relax with your family, just talk through your anxieties with someone, and just make sure you know what you're going to do on the test day, and I'm sure you'll be fine, and good luck. What advice do you have for interviews? Just be confident, be yourself, make sure you've read up on NHS hot topics, make sure you're up to date with medical news and what's currently happening with junior doctor strikes, with the Lucy Letby trial, because those are the things that's going to be tested this year, probably, because those are the ones that have come up in the media. How long before your interviews did you get told about them? I had a week, so it wasn't really that much time, but it was fine. I practiced with my parents, practiced with a teacher at school, so yeah, it was fine. By what point do you have to know your plan B for career choices? I mean, what do you mean by that? Do you mean to apply to university, or do you mean once you're in medical school? I have only done virtual work experiences. I couldn't find any hospitals. No, virtual work experience is taken at the same level of importance as in-person work experience. But I think now, because there's no longer any restrictions, they do expect you to have some sort of face-to-face work experience. So you might want to try arranging something. Yes, for once you're at university, I mean, you can decide whenever, really. I would probably say, if you're deciding to apply for what courses to apply, probably before the 15th of October, because that's when the deadline is to submit for medicine. If you're thinking of medicine, that's when you need to know by. For all the other ones, I think it's January or something like that, I can't remember. But once you're in university, if you're not sure whether you still want to do medicine, you can, after your third year, you can just go to finish uni. You'll still end up with a bachelor's, because it's like a third year, it's like a 3-year course. So you'll have a Bachelor of Science, basically. And then you can do whatever you want. It doesn't really matter. Or you can finish the full 5 years of medicine and go into something else. I don't think that's a problem at all. But obviously I wouldn't recommend it, because it's 5 years of really, really hard work. And then if you don't actually want to do it at the end, I mean, it doesn't, because you do go through a lot of difficult things in medical school. It doesn't seem right. You might as well do a different degree. Is there anywhere you can get free interview practice? I'm not really sure. Have a look online. I'm not really sure, actually. I just got a book and I practiced the questions in that. So I don't know. I'm not too sure. I have my UCAT in a week. Should I take a break from school? It depends on your scores. I mean, if you're still managing to come back home and do some practice in the evening, I'm sure it should be fine. I don't think you need to take a break from school. Do you have any advice for decision making? Make sure you go over your probability, your mental maths, because there are some mathsy questions in there, and make sure you read the information properly. Will any more webinars be conducted by 6med? I think they are running more on Sundays. I just don't know what dates they are. I'm not sure. Is it worth taking a gap year to reapply to top unis, or should we just go to a more standard uni the first time round? First of all, I'm just going to say all unis are top unis, because you're all coming out with an MBCHB or an MBBS. So it doesn't really matter which university you go to, because you have to remember that when we finish medicine and we start becoming a doctor, we all need to be standardized junior doctors. We need to have the same level of knowledge. and all universities are very good at making us meet certain criteria, which are the same across all unis. So it doesn't matter whether you came from Warwick or whether you came from Bristol or whether you came from Imperial, you're still coming out with the same degree. So I don't really think there is a top uni specifically for medicine. Will any more UCAT related webinars be conducted? There should be, I just don't know when. What was the interview practice book you used? I'm not sure. Have a look on Amazon, because obviously I interviewed about 6 years ago now, in 2017. So there'll probably be some new ones, but just put in like medical interview books or medical interview questions and they should come up. I'm not sure. I think I've been asked that question quite a few times now. I'm not sure how to access the 6med webinars. I would ask someone, I would email 6med and ask them. Okay, so there's no more questions, so I'll end it there. And hopefully you guys found this useful. No problem. Does not taking biology A levels reduce your chances of being accepted? No. I only know about Bristol. I don't know about other universities, but in the first term, if you haven't taken A-level biology, they do arrange like extra sessions that you guys can attend, which are like mini lectures or seminars if you haven't done biology, so you get up to speed. But yeah, when you come to university, you'll probably have to attend those.